Okay. Thank you everyone for joining us today. My name is Jean Marie Alves Bradford. I am the director of the Columbia Psychiatry Office of Equity, Diversity, and Inclusion. I will be moderating this event. Our office and the Department of Residency Training here at Columbia Psychiatry are so delighted to have you join us for our wonderful speakers here today. Our office started in October of 2020. It is committed to lead and coordinate equity initiatives in our department and to partner with departmental leaders to do so. We, along with the Department of Residency Training, are committed to training our faculty and the next generation of leaders to work toward the goal of health equity. Each of these talks will help to make our learning environments more inclusive for our learners, our faculty, and the people that we serve. The overview of the event today will first have a wonderful opportunity to hear from Dr. Pieterse Harris, and then at 1 p.m. We will start with one of three talks, and we'll have 15 minutes in between each of those longer talks. So it's my pleasure to introduce Dr. Pieterse Harris. She's a visiting professor here at Columbia and the immediate past president of the AMA. We're so fortunate to have her expertise here at Columbia in general, including her role in consulting to our office, including her expertise in health equity and as a leader at national levels. Her insight and advisement has been really invaluable to me, and I'm really fortunate that she's part of our department. She's had diverse experience as a practicing child psychiatrist, public health administrator, patient advocate, and medical lobbyist. And she's held leadership at the state and national levels, including chief health officer for Fulton County and president of the AMA from 2019 to 2020. And she's currently the immediate past president of the AMA. And then following Dr. Harris, we will, her first longer talk will be Dr. Kupiri Ackerman-Barger, who's going to talk about microaggressions. Following that, we will have Dr. Alex Pieterse, who is going to talk about addressing race and supervision to improve trainee and patient outcomes. And then our last talk of the day, which will start at 4 p.m., Dr. Nhi-Ha Trinh will talk about centering cultural humility in psychiatric education. So it is my great pleasure to introduce Dr. Pieterse Harris.
Well, good afternoon, everyone, and thank you, Jean Marie. Certainly, it's been a pleasure and a privilege to be able to work with the Columbia Department of Psychiatry as the department, and I do believe Columbia proper is embarking on this journey. And I do talk about this work as being on a journey because many institutions, academic, business, other enterprise, large and small, have stated a commitment to this work. I think COVID-19 has certainly elevated the importance of the commitment of this work, but I know that many of you on this call have been working on this for many, many years. And so this is not new work. But it is newly amplified work. And oftentimes people ask me, well, why now? What's different, right? We've been working, some of us have been working on this for 30 or 40 years, and I think we should acknowledge that. But I do think that we do have a unique opportunity since this work is newly amplified. And I also think the paradigm has shifted. This work has traditionally been the responsibility of perhaps a person, a task force, a small group of committed faculty members with no additional resources. And I think that's different. Now, at least that's the stated difference. And what I believe is happening here in the Department of Psychiatry and other institutions, not all. There are some institutions that have simply declared a commitment to this work and not put forth any resources, not put forth any metrics, no specific areas of accountability, but some folks are at least on their journey to do just that. And what was attractive to me to come to Columbia and be your thought partner on this work was the commitment from the top. And that is Jeff. Jeff stated, a commitment to own this work. And I think that that's critical because, again, back to my point, this is not Jean Marie, this is not, and I don't like to use people, but this is not the Office of DEI's responsibility. This is everyone's responsibility. Certainly the leader has to own this. The CEO of any hospital has to own this. The CEO of any business has to say, I own this. Now, I am a sports fan, so I apologize for this sports analogy for those who don't like sports analogies. But it's like, you have the quarterback, and Jean Marie's a quarterback, but you have to have the coach, and that's Jeff. And then you have the team members, and that's all of that. So everyone in the department, and again, I know I may be preaching to the choir, but I think it's helpful to say these things explicitly. Everyone has to have ownership of this work. Everyone has to have ownership of this work. So I bring to this work, again, my own lived experience as an African-American woman, a patient, someone who's been in the advocacy arena here, of course, led a large organization, 30 years of work, like many of you, but 20 years of work, I have to say, as part of the AMA. And I am immediate past president for, about another 24 hours. But what I've had is the wonderful opportunity to see an organization like the AMA change. And I think it's model for organizations that are imperfect, who are willing to do the work, who are willing to look inwardly, accept flaws, apologize for flaws, and again, make sure that that's an ongoing process. So I just want to show one quick slide of how we think of this at the AMA. And again, not that the AMA's way is the only way to do this, but certainly it's a model. So I want to make sure, are you seeing the organizational strategic plan, the circle? So what I think is important, and you may hear some background noise, the AMA House of Delegates meeting is going on as we speak. And right at this very moment, we are discussing our equity plan. But you see here, what I like about this is equity is not set aside, right? It's an accelerator. And so the AMA, we have 3 strategic arcs. I'm sure Columbia Department of Psychiatry has 3 strategic priorities. Ours are chronic disease, professional development, and removing obstacles for physicians to take care of our patients, or for academic physicians. Remember, we have a diverse group at the AMA, but for all of us to do our work, whether it's direct patient care, doing the best research, so forth and so on. So those are our strategic priorities. So you could say, what are the strategic priorities of the Columbia Department of Psychiatry? And then there are accelerators to that work. In the AMA, we think equity is an accelerator, right? So that you can't do any of that other work without equity, right? Accelerating that, of course, innovation and advocacy. So we, again, see all of those sort of in that circle working together to accelerate. And then, of course, the foundation is science. Of course, this is, again, AMA's membership. Of course, you have to have dollars. And so that would be equity plan. You have to have financial resources, and you have to have talent, and you have to have engagement. Now, when you're speaking about health equity, of course, you have to engage. You have to think about not the usual suspects to engage. But again, that engagement is everyone on this call, everyone in the department. I believe that Columbia University proper is thinking about and committed to this work, at least the health system too. So everyone has to be engaged. And then the people we take care of, the communities we serve, they have to be engaged. But this is also new, engaged in a new way, right? I think we should look at how we've engaged in the past. Most often organizations with resources, and I know the most about AMA, but I know Columbia has some resources and it has a great reputation. We've sort of, gone in and helped, and sometimes well, always well-meaning, but perhaps not always shared decision making and shared power even with some of the some of the institutions or communities we serve. And so it's about going in a different way, and it's also about making sustained commitment. For example, Columbia, I know you're doing great research in the community, and so it's about going back to the community and say, when you all participated in our research, here's what we found out, here's what we learned, here's how we can bring this back. And that's that sustained engagement that I believe also is part of the new paradigm on this health equity work. So again, it's been great to so far be a thought partner with Jeff, a thought partner with Jean Marie, but all of us should consider ourselves partners in this work. And I look forward to continuing my work at Columbia. So thank you very much. I won't be able to stay for the rest of the day, as you know, again, finishing up my work at the AMA. But again, I look forward to continuing to work with you at Columbia.
Do you have time for just one or two questions?
I do.
Okay, great. If anyone, I'm sorry, what's that?
I'll stop sharing my screen.
Oh, okay. If anyone has any questions that they would like to ask Dr. Harris, please unmute. I do have one question while other people may be waiting and considering their thoughts about the best ways in, or what are the best ways to partner. So for those people who might, want to engage in this work but don't know where to start or to begin, what do you recommend for those?
Well, again, I think you are a great resource there, and so everyone should. That's a great question, and that's the best question. How do I start? And I will say you can start small, and it will be a different answer for everyone. But I think Jean Marie or I would be happy to be your thought partner on how you start. I'll get to know you, learn what you're doing at Columbia, what's your specific area of work, and how you can get started. And again, it will be different. Sometimes the start is within. So sometimes the start is reading a book. A book that I've been recommending, if you haven't read it already, is Cast by Isabel Wilkerson. So again, you can start very small. Another start, by the way, specifically around healthcare, is to read the AMA's plan. It is a bold plan. But it is a plan that we believe will move AMA forward. But our goal was to be a model for large institutions, and so two things: you start by either reading the book or going to the website and just start with reading AMA's plan, because it's not about AMA, right? It's about healthcare and addressing structural racism in healthcare and a lot of other issues. So I would say those are two places where you could start.
Thank you. Does anybody have any questions people want to ask at this moment?
No, but I came at the end and I just wanted to echo that book Cast by Isabel Wilkerson is fantastic. It really sets the tone about bias and racism here in this country. And if we really want to take it a step further, My Grandmother's Hands by Resmaa Menakem is an excellent book about the trauma that people of color, the BIPOC community, experiences here, and some coping and treatment strategies that can be employed by healthcare providers.
Thank you, Dr. Boudreaux. Hillary, could you put the links in the chat for those books? That'd be great for everyone to, get that information. I mean, that is one of the things that's been really wonderful lately, is just a wealth of resources. And there are a number of resources that we will put up on our website, our Office of Equity, Diversity, Inclusion, so that you can enter in at where you might feel that you can. Some things, coming to this talk is one of those things, coming to this event and seeing one or more of these talks. Also reading the books, as Dr. Harris and Dr. Boudreaux mentioned, and there's podcasts, but it is important to do our own work and to learn as we grow, and to grow as we go. So that's
I like that, Jean Marie. Learn as we grow and grow as we learn. And let me add one more thing that I have recommended to everyone, from CEOs to major corporations to small nonprofit organizations. We have meetings. Of course, all of us try to minimize the number of meetings that we have. Certainly now with Zoom, it's meeting overload. But typically, we have the person in the room, maybe a BIPOC person, maybe LGBTQ people in the room, that probably folks sort of have this reflexive habit to rely on folks who have been impacted the most by some of the work, to also be the ones that have to have the responsibility to speak up. And so let's get out of that habit. So one additional pointer I would have is on the very top of every agenda, electronic agenda, and this is easy to put in now, there should be a first question. So the first agenda item before you get into your official business or the agenda items for the meeting is to ask the question, who is not around this table? And that should be explicit, right? Because it shouldn't be Jean Marie or me or anyone else saying, you know what, let's look. So if that's on the agenda item, it then forces, if you will, or I would say it allows the opportunity for everyone to say, who's missing? All right, looking quickly at our agenda, who should be around this table? Or it just makes you realize that when you are around a table that is not very diverse, there is work to do. And sometimes, again, we're all very busy, and those of us in psychiatry are even busier with COVID. We have our heads down doing great work, but you have to be intentional about this work. And so I say, add that as a question at the beginning of every meeting. And then at the end, there's one other agenda item is, in all of our discussions, did we maintain fidelity to the department's stated commitment? And the department has stated a commitment, right? And so did we, in our discussions and our deliberations on an agenda item, whether it was research or what grants we're going to, or NIA grants or R1 funding, or the communities that we serve in outpatient care, and were we faithful? Did we maintain fidelity to our stated commitment to equity, diversity, and inclusion? And so I suggest that one explicit recommendation on agenda items.
fantastic. Yeah, I'm fortunate to have heard you say that before, but I think that's really good, and hopefully we'll be able to spread that a little bit further along. Anyone else have any comments that they'd like to make before we only have Dr. Harris here for a few minutes? Hi, Dr. Barnes, did you want to say something? Good to see you.
Hi, I'm joining you from outside of New York as well. I had a quick question, or maybe not, but in some of this work and the pushback that has some in our discussions that can become divisive at times, I'm just wondering if there's any things that you found helpful in creating inclusive and conversations to kind of further headlock that can sometimes come from, well, why are we, like I've seen comments and interactions where this, well, why is this important? And so for those people who are starting from that point, how do we invite them into conversation and move them along, if there's any tricks that's been helpful?
Well, we show them the data, right? Again, we show them that we have patients who are experiencing negative health outcomes because in healthcare, we have not been as intentional and committed. Listen, we are all committed to providing the best care, but sometimes there are other issues that have that do intrude on that. And some of those are individuals, most of those are systemic, right? But we know that we have to look at our own and examine our own implicit biases. And by the way, this is where, and I've said this for many years pre-COVID, I think psychiatrists are, and I'm sure there are other mental health professionals on this call, we should lead all Fortune 100 companies because we believe in surfacing elephants, right? I mean, that's what we do. We're trained at it. And now sometimes we actually don't do that within our own departments and organizations. We have to do that, but we're good at it. We are at least trained at surfacing elephants. But when people say, well, why? Well, here's some data around health inequities, right? And part of it, not all of it, it's complicated. But here are some data around redlining and housing, which led to tax bases and how do we fund education in our country, property taxes. Here's where we have under-resourced hospitals. I mean, why in some communities you have hospitals that have 1 MRI and in other hospitals they have 10, you know, and how is this and what do we need to do? And those are systemic issues and those are structural issues. So there's lots of data, I think. And so folks say, why? If every day we wake up in the healthcare field and are committed to improving health care in this country, we can show that that is not working. Right. So I think it's the data. And then, you know, there's business data, less so in our field, but business data to show that higher performing companies, those who are returning more dollars and more value to shareholders, are companies that are diverse. Listen, people make a lot of, and actually we have to also think about the environment. And there's candidly less of a margin, and I'm not saying we should be politically correct, and I'm not saying that, but there's less of a margin to make mistakes. And so let me just share this one mistake that didn't have anything to do with race or ethnicity. I was talking to some folks and they were sharing about an organization. I think they built a brand new building, right? And it was a fancy, shiny new building and the architects in the room, and they had built this wonderful staircase and it was a clear staircase, right? And it was beautiful. All of the folks who designed and looked at that staircase were men. No women in the room who a woman could have surfaced, you know what? Walking up that staircase, if you have and actually everybody can wear a dress or a skirt, right? So it doesn't have to be, you know, just a female gender, but you could see up the staircase, right? If you're standing below, because it was all glass. And so that's sort of a humorous example of who was in the room when that decision was made. That was a costly example that they had to tear that down. Or they didn't tear that down, actually, they did some other improvements, but that cost them money. And so this is what they were saying, all of the money that we had to spend on this. So that's a slightly humorous example, but there's a return on investment financially for not having people around a diverse group of people around the room. So I would say, here's the data. Now, there are some people who you won't be able to convince because they can read and you can give them all of the opportunities to read and learn. And then you have to move on with the folks who are willing to get the work done.
Thank you.
You're welcome.
Thank you so much, Dr. Harris. It's always a pleasure to have your insights. So it is now 1 o'clock, and we're gonna have Dr. Kupiri Ackerman-Barger here. I do see her, and so we will get started.